Hello, everyone. Thank you so much for joining us today. Uh, Today's live stream is Demystifying Diabetes Myths, Facts versus Fiction. I'm Kayla Bowen, Digital Marketing Specialist for Byram Healthcare, and I'm excited to be joined by diabetes experts Alicia Downs and Anna Sabino. Alicia's running a little late, so she'll pop in when she can, but we're going to get started with Anna. And they'll be sharing their valuable insights and addressing some of the most common myths and misconceptions about diabetes technology and management. Byram Healthcare has been a national leader in patient direct medical supply delivery for over 50 years, rated the best overall diabetes supply company by Verywell Health for 4 years in a row, with an A+ rating with the Better Business Bureau. We're your trusted partner in diabetes management. And at Byram, we know that life takes care, and today's conversation is one way we are fulfilling that purpose. Before we begin, please note, nothing stated today is intended to be a substitute for professional medical advice, diagnosis, or treatment. Our discussion is for informational purposes only. Always seek advice from your healthcare provider for any specific medical conditions. Okay, so right now we're joined by Anna Sabino. She has been living with type 1 diabetes for over 30 years and proudly offers expert emotional counseling, emotional health counseling for children, adults, and families with type 1 diabetes. Her areas of expertise include family dynamics, crisis management, anxiety, depression, burnout, and post-traumatic stress. Anna, do you want to expand on that and introduce yourself?
No, you did a really good job. I'm thrilled to be here. It's obviously Diabetes Awareness Month, and yeah, working and educating the world about diabetes is one of my biggest passions, clearly. So, from both a personal and professional experience, thrilled to be here. So, thank you for having me.
Amazing. I see you've got a pup in the background.
Yeah, he's taking his afternoon nap. Apologies for
Aw,
his he's joining me here.
no worries. We're happy to have him. So cute. What's his name?
His name is Orvis,
Orvis.
like the store.
Okay.
Yeah.
Love that.
Lab.
And Anna, you're based in Boston,
I
correct?
am. I'm based in Boston. A lot of medical stuff here and research. Um, Always kind of been in the Boston, sort of New England area. Don't really have any plans on leaving. But I have two kids. They're 5 and 7. Knock on wood, neither of them live with type 1, and I hope it stays that way. But yeah.
Great. And I am based in New York. Okay. Let me pull up my questions. Sorry, it just logged me
Okay.
out all of a sudden, right when I was about to get started. Um, well, I know that there are a lot of misconceptions about diabetes. Why is that?
We could have a whole hour and a half, 2 hours about this subject. I mean, diabetes, as many people here, is, one of the 6 leading cause of death. And I think one of the hardest things to explain about diabetes is that it really is a whole body impacted post diagnosis. If Alicia were here, I know that she would say, diabetes, whether it's type 1, type 2, gestational, pre-diabetes, yes, it's a clinical disease, but it's behaviorally managed. So the success of diabetes is really weighed upon our habits and our behavior changes.
Mhm.
So, a lot of people think, oh, yeah, things can shift, or maybe you're cured. Well, there is no cure for type 1 diabetes. And it's a little more complicated with type 2. So I hope that answers your question. But for me anyway, living with type 1 for so long, it affects every single decision of my body, how I move it, whether it is exercise, 5-minute walk or, eating 4 crackers, and those to most people may seem like nothing, no big deal, grab a snack, go for a walk. My every single day, and most people's every single day, diabetes plays a role in the ability to just make those very minute decisions in one person's day. So, and a lot of that is hidden. We don't just like announce to the world when we like go grab a snack or go for a walk, oh, I have to check my diabetes, or oh, I have to look at my blood sugar before I do something really simple.
Mhm.
And I think that's why there is so much about it, because so much goes into the behavioral management of it. And it is so much more than just a bunch of diagnostic criteria and numbers on paper.
Right. Right. So, myth busting time.
Yep, here we
Let's
go. I
let's
love this
start.
game.
Yeah. Okay, let's start with some about type 1 specifically.
Sure.
So, our first myth is that type 1 diabetes is caused by eating too much sugar.
Whoa, that's a big one.
Yeah.
Yeah. I don't even know where to start with that. That is completely false. Type 1 diabetes, as many people know, and a lot of people don't know, we actually don't, we know that the main cause is that the cells in our pancreas, the beta cells, like break down and are no longer able to produce insulin, or enough insulin, that the pancreas is now dependent on insulin, which we all know is a hormone that helps break down the glucose that we need for energy, yada, yada, yada. Um, there is a slight genetic component for immediate relatives, but it is not caused by eating too much sugar. Absolutely not. There are so many studies, hundreds of studies, research studies trying to figure out that why.
Hmm.
Um, but that is absolutely not true. I was a very healthy, 6-year-old when I was diagnosed. Alicia was diagnosed, I believe, at age 12. I don't want to speak for her, but no known immediate family history. My parents didn't feed me like Coke and cake and all of those things to cause it. There is a lot of, viral triggers that sometimes can cause a destruction of beta cells, or the start of destruction of beta cells,
Mm.
um, that can trigger an onset, or slow onset of the diagnosis of type 1 diabetes. But the diagnosis itself of type 1 diabetes is never caused by eating too much sugar. Type 1 is very, very much an autoimmune
Right.
illness that falls into the same category as things like celiac or Crohn's or colitis, lupus. So if you think about it in that sort of category, sometimes naming some other illnesses where that falls can be helpful.
Right. Yeah, that definitely helps put it into context. Um, so our next myth, only children can get type 1 diabetes.
Totally not true. And actually, I would say, especially in the last several years, like the average age of diagnosis has increased. Um,
Mm.
you can be diagnosed with type 1 diabetes at any age historically. It is much more common to be diagnosed in childhood.
Mhm.
We still don't know why, but I actually know several like 50, 60-year-olds who have been diagnosed in the last 5 years.
Wow.
It may be because we have better screening. It may be because we are able to do finger pricks and, more easily detect high blood sugar and try to prevent an onset, which could involve hospitalization. But I believe I actually saw somewhere a statistic that said the average age of a type 1 diagnosis is now like close to 24.
Oh, wow.
Yeah, much higher. Don't quote me on that, but I did see a piece of research recently, especially because there's like statistics flying around, November Diabetes Awareness Month.
Right.
But more and more college age students, young adults are being diagnosed with type 1. So, and the national organization, formerly known as Juvenile Diabetes Research Foundation, just in the last 6 months, completely rebranded to become Breakthrough T1D, because the word juvenile really doesn't necessarily fit in with the type 1 diabetes mantra anymore.
Right.
So, there's that.
Yeah, yeah, that makes sense. I mean, so I'm curious, when you mentioned someone being diagnosed at 50 or 60,
Mm.
how do you go that long without a diagnosis? Like how does that affect your life up until that point where you finally get that answer?
I mean, if you're receiving a type 1 diagnosis at 50 or 60, you're likely not sick for decades. Your body may something again may have just triggered some type
Mhm.
of, C-peptide destruction or something that is a little bit more invisible. Not everyone is admitted to the hospital in what we call diabetes ketoacidosis or DKA at diagnosis. And in fact, we don't want that. We want people to really just say, "Oh, I've been thirsty lately, and I've been going to the bathroom more often." And I mean, we never want a diagnosis, but we would much prefer, from the clinical perspective, to sort of nip any type of future hospital admission in the bud before it gets to that
Right.
state. Because once we get into diabetes acidosis kind of state, things can go south very quickly. So you can go years. I know several people, especially with the COVID epidemic, were diagnosed within maybe 6 months to a year after having COVID-19. So there is a lot of research out there that indicates a big uptick in toddlers being diagnosed, and a big uptake in older adults that were exposed to a new virus. It has an impact on their immune system, and we just don't know enough yet about
Right.
the why.
Right. Yeah, we got a comment saying, remember when they called it juvenile diabetes?
Oh yeah. Yep.
Yeah.
And that's why. We didn't have the technology, we didn't understand, we didn't have CGMs. Back when I was diagnosed in 1989, it was like a big deal, like a huge parade to prick a finger. You had to wait wait 60 seconds, then put um the thing in the strip in. It was a much bigger deal to get blood work done and perform a simple task like a finger prick. So we've certainly come a long way.
Right. Yeah, absolutely. Um, okay, so our next myth. People with type 1 diabetes can't eat carbohydrates.
Whoo, pretty far from the truth there. So the hard part with this is that everyone needs fuel for our body, right? Like we can't survive without fuel.
Mhm.
And carbohydrates are things like fruit, fresh fruit, and even milk, and bread, and pasta, and potatoes. I think a lot of people just assume that the very refined carbohydrates that include a lot of processed foods and sugar is what people sort of have this definition of carbohydrates is. And like, yes, those will
Right.
raise your blood sugar level, which sure, that's what we want to avoid. But we also know that it is inevitable that a rise in blood sugar, even for people without a diagnosis of diabetes type 1 or type 2, will happen. If you ask any human who is living without diabetes to wear a continuous glucose monitor, which will track their blood sugar, every 5 minutes with updates, you will never not have a straight line. You will never have a straight line. I mean,
Right.
it will go up. It will probably go up to maybe 140, 150 and come back down on its own, and that's what you want. But if it were flat the entire 24 hours, like you'd be a sedentary, like nothing,
Mhm.
like lying
Right.
on the ground. Like it means you're not fueling your body. It means you're not moving your body. It means you have no hydration. You're not burning calories. You're not inputting calories, because blood sugar is a completely fluid situation. And that means you have fuel moving throughout your body, and like taking it a step back, which is what we want. Food is still fueling our body and we still need it. It just means that we living with type 1 diabetes especially, and some with type 2, require insulin to help mitigate the fact that we don't have it, to sort of meet it halfway, to break it down on its own. Sometimes giving insulin can be complicated for more complicated foods like your high fat, high protein, really refined sugary foods like pizza, mac and cheese, some of those, more desired foods. But that certainly does not mean we can't have them.
Right.
It just means it might involve like a little bit more strategy to kind of hope for the best. But as someone who works very closely with children and young families, it's much more detrimental from the mental health perspective to avoid those and restrict those types of foods from, just like a childhood experience than it is to try to, navigate what that bolusing looks like.
Mm, right. So, on that note, another myth is that once you have type 1 diabetes, you can't lead a normal life.
Ugh. Well, I think it depends on how you define normal.
Mhm.
I can certainly share that from my perspective, I'm probably pretty normal. I don't That's questionable by my family, but I grew up, I went to high school, I went to college, I went to grad school, have a job, have a dog, bought a house, studied abroad. I don't think there's anything that I have done that diabetes has restricted me from doing. I think so many people feel like, oh, I can't have this because of diabetes, or I can't do this because of diabetes. And I really would challenge you all, if you're a parent listening or whoever you are listening, to really, really ask yourself, is diabetes the real reason? Putting on my social work hat here, is it really the root cause and underlying reason of you not being able to move forward with what you want to do? Or is there some underlying root cause fear
Mm.
that is the reason? And then if it is, then we can break down into the why and set some goals and figure out how to make that happen. I mean, if you want to climb Mount Everest, sure, there's people that do it. If you want to, go live on a chicken farm and raise 100 chickens, go for it. My grandmother's motto was always just if there's a will, there's a way. And so
Mhm.
it really comes down to, what's your values and what are you motivated by?
Absolutely. Yeah, I mean, that makes total sense of there being other reasons that are holding you back.
Mhm.
Like the fear or just the overwhelm of having to manage your diabetes in order to enjoy pasta in Italy or something. Um, okay, so some type 2 diabetes myths to debunk.
Sure.
Um, First one, type 2 diabetes is only a disease of obesity.
Nope. Nope. I know plenty of people who are extremely healthy and have a raised A1C, or you would sort of consider them type 2 and have a diagnosis of type 2 and are not overweight at all. Type 2 diabetes is different. It's a different sort of pathway to diagnosis than um, type 1, in that it is a metabolic disease where it is a little bit more genetic in that sense, where it's if your genetic makeup is like your parents, your body type might be similar, your heredity, your skin tone, all of those things are part of your genetic makeup. And part of that is your, potential to develop something like type 2 diabetes. I mean, so um, I think with type 2, a lot of it comes down to your genetic makeup and what your family history looks like. Coupled with obviously behavioral habits and things like that. But we all know that parents model behavior, grandparents model behavior. So it's really important to kind of like break that cycle and understand what your medical history looks like if you're potentially down that path. But I actually think there are statistics out there that say like maybe 60 to 70% of people are considered like overweight or obese who have type 2. It is a risk factor, but it
Mhm.
is certainly not a guarantee for sure. I know plenty of people who are very obese who don't have a diagnosis of
Yeah,
type 2 diabetes. So it's not a direct correlation at all.
right. Um, Number two, people with type 2 diabetes don't need insulin.
This is a tough one because it can be true, but if you're it really really depends. And I would actually say that type 2 diabetes management from a prescription perspective involves a little bit more often changes in management sometimes for adults than people with type 1. For me, I must have insulin, my insulin pump attached to me at all times. I must give insulin, and it's a different amount, every time I put something into my mouth. And for type 2, most people are not put on insulin right away. They may be told to take something like an oral medication like metformin or to work on diet and exercise. It really just depends on the presentation of each patient.
Hmm.
However, there are plenty of people who are diagnosed with type 2 who over time may become so insulin resistant um, or so insulin dependent that they need to be on a pump or that they need
Hmm.
to take insulin coupled with a lot of other medications on the side. But usually, insulin is not the first drug that a patient is put on if they, I don't want to use the word have mild type 2, but if their A1C is not as high or their blood sugars are not as volatile, that sort of thing, if that makes
Right.
sense. But
Yeah.
every single person's body is different. Every single person's journey is different. There are so many different restrictions and types of medications based off of side effects and other, counterindications with other medications that you might be taking for, say, something like blood pressure or I don't know. Yeah.
Yeah, that makes sense. Um, from what I've seen in like online discourse,
Mm,
for example, is that like sometimes there are people of the type 1 community who feel like they are not associated with the type 2
mhm.
community. Why do you think that is, and why is that not a good way to think about it?
Well, I think one of the first things to remember is that 95% ish of people living with diabetes have type 2.
Right.
Um, so type 1 diabetes is still a very, very, very small percentage of those of us living with diabetes. And if we're not categorizing it on billboards, if we're not categorizing it and specifying the type when we're speaking out loud, in comes the stigma and
Hmm.
in comes that feeling of resentment for people with type 1 and those statements like, oh, people with diabetes get type 1 get it because they can eat too much sugar. And
Hmm.
now that we've sort of like myth busted a little bit, you can sort of see maybe why that's annoying, because there's a lot of money put in diabetes in terms of drugs and obesity management and weight loss. And societally, most people in America, like a lot of people at some point, want to lose weight and may or may not have diabetes. And it's very easy to put everything together and just say the word diabetes. They have the same unfortunate complications if not managed well, and some of the same overlapping medications, but very managed very differently. There's like hour by hour management that is like dependency when it comes to type 1. Um, And type 2 and like pre-diabetes, it's just much different. So
Yeah.
we feel like we work so hard day in and day out, and it is a very invisible illness, what we go through. I have my blood sugar, attached to my watch, where you can see what my blood sugar is. And there's a lot of shame and guilt that is associated with the connection of behavior and have I done enough,
Mm,
that comes into sort of that mental health piece of diabetes, because so much of it is just hidden.
right.
Um, Most people aren't in the grocery store being like, my blood sugar is dropping. I'm not sure if I should have some glucose tabs or not. What do you
Right.
all think? Like we're basically become doctors overnight. And a lot of type 2 medications is take this with a certain dose prescribed to you once or twice a day and hope for the best and check your blood sugar, and that's it, and watch what you eat. For us with type 1, we are making dosing decisions at every point of food consumption for
Right.
our bodies. So there's a little bit, I hate to say it, I feel like there is a little bit more weight mentally and physically on our shoulders when it comes to just the day-to-day management
Right.
of diabetes for the most part. And I'm generalizing here, but
Right.
that is a lot of where the sort of like comes from, is
Yeah.
that a lot of it, people sometimes just don't want to separate it out, because it's easier not to. And there's money in type 2 because there's a lot more people with it.
Right. Right. Um, so continuing on, you can reverse type 2 diabetes by simply losing weight. True or not?
Must be nice. No. um Again, this is a really individualized illness, disease. You may be, I'm just going to kind of make up a case scenario here. Say like Bill walks in, he's 65 years old, he's overweight, his A1C is like an 8.5, which is an average blood sugar like over 200 or around 200. He's told to reduce some calories, start eating more vegetables, and check his blood sugar in the morning for, a fasting number. Drink more water, basically just do some lifestyle things. His A1C may go down, and that does not mean he is cured. It does not mean he is cured. He's still going to be monitored. Once you have a diagnosis, you have a diagnosis. That doesn't necessarily, it means that your medications may be adjusted. It means that, again, it rests a lot on the behavioral management of the person living with it. And it involves a lot of motivation, a lot of support, a lot of familial support, and a lot of like real focus and dedication to lifestyle, maintenance and shifts. So, yes, there's a chance from a prevention standpoint for you to maybe reduce your medications or attempt to go off them. I would say that doesn't happen super often. Um, but yeah, some people, if they just sort of are in maintenance mode, maybe they have less appointments, or maybe they no longer need to see a nutritionist. But I don't know anybody that has just been told you don't have diabetes anymore.
Right. I know that there's like discourse about whether or not type 2 diabetes can be cured, or whether type 2 diabetes remission is real or not.
Yeah, I think also too, this is a deeper conversation that relates to healthcare. A lot of type 2 people living with type 2 diabetes will get their endocrine care from their primary care physician, and they may say, "Oh, you know what? You're doing really well with your diabetes management. I'd like to see you in a year." And that may be perceived as, woohoo, I'm cured. I just have to keep doing what I'm doing. So
Mm.
I think it's really all in the perception of the patient.
Mm.
It's all relative, because so many people really probably should be seeing an endocrinologist or a, diabetes care and education specialist like our team does at IDS, really doing in-depth like clinical management. And a lot of our patients across the US, especially, just don't have that kind of access. So it really comes down to the perception of that patient and the, patient provider relationship in that standpoint.
That makes sense. Um, so another myth. Type 2 diabetes only affects older people.
I wish that were true. Nope, nope, and nope. And again, this is, I feel like everything in terms of screening is moving just like a little bit younger, like mammograms, colonoscopies. We
Oh
have
yeah.
the ability to start detecting some of these things earlier. So we're not doing as many like amputations. We're not seeing as many um, real, I don't know what word to use. Like, I don't want to use the word complication, but we don't want to get to that point. Nobody wants to see a patient in crisis. As a social worker, nobody wants that. And we do know that because there are a lot of overweight kiddos and overweight young adults, the ability to screen for and therefore diagnose these younger kiddos with a finger prick is possible. There are, more specific, hereditary genetic components that come into a diagnosis or screening for children and young adults with type 2. But we definitely see type 2 diagnoses in teens, kids, young adult. And unfortunately, most of those diagnoses stem from parents with a diagnosis.
Mm, that makes
Or a
sense.
strong family history, I should say.
Right. Okay, so now let's jump into some more general myths. Um, First one is with diabetes technology like insulin pumps and CGMs, people with diabetes don't have to work to keep blood sugars in range anymore.
Yeah, right. I would say wearing a CGM is the best piece of technology that has ever like happened to me. Nothing about the pathophysiology and anatomy of diabetes has changed. There
Mm,
is no necessarily like physical cure that is going on naturally in my body to help with blood sugar management. And I know, 99% of people living with type 1 would agree with me. The CGM helps prevent and predict high and low blood sugars to keep blood sugars more in range. And we know that when we keep blood sugars in a tighter range, it is preventing both short and long term, complicated aspects of what can happen with type 1 diabetes.
right. All right. Next one. People with diabetes have to follow a special diet.
Ugh. Um, I will say, someone who was diagnosed over 30 years ago, we've come a long way. Insulin, when human insulin was first discovered, over 100 years ago, um, and even up until, the mid 90s, insulin was very time based and it only worked and peaked in the body for a certain number of hours. So your long acting insulin really peaked, 6, 7, 8 hours after you um, gave the injection. So you had to be a little bit more restrictive when you were eating and what you were eating, because remember, we had no CGM. So we had no idea what was going on in the background. And so we had to basically meet diabetes where it was. And now I think there's, because of the technology, been this sort of mental shift where diabetes is adapting to our life and not the other way around, which I think, if I could say anything to, the rest of the world listening, that is the biggest mindset shift, I think, over the last several decades with the technology that we have been able to do, is that we don't let diabetes control us, even though I don't love
Mhm.
using that word, but we adapt it to what fits into our life. What
Right.
works for you already, and how can we fit diabetes into your world? And 30 years ago, that's not how diabetes was taught. It was taught, you're right, you need to eat, we're going to prescribe you this diet, and because this is how you live your life, you're going to give your insulin at this time of day and this time of day, and this is what we recommend from a food standpoint to meet the insulin where it is.
Right.
If that makes sense.
Yeah, that does make sense. And I mean, if you wouldn't mind sharing a little bit about like your personal experience being diagnosed as like a young child, like how did that like impact, your diet and just how you moved about the world, around other children who didn't
Yeah.
diabetes? Like what was that like for you?
I mean, I was diagnosed in kindergarten, and I will say there were definitely days where, I remember having to leave class early to go prick my finger at lunchtime. And I remember not being able to have a cupcake at a child's birthday party, and my mom or dad having to come over to the sleepover to help me do a shot when I was 9 or 10, because there was no technology.
Right.
There were definitely restrictions, but when I think back on my life as a kid, it doesn't dominate my like core memories. If that's, I have memories of life as a kid, and like places I traveled to and who my friends were. And then later down in my like memory inbox comes diabetes.
Mhm.
It wasn't that I couldn't do X because of diabetes, or I couldn't go on the field trip because of diabetes.
Right.
If anything, I was able to go to summer camp and meet all these amazing people with diabetes. And my mom was able to come on field trips because I had diabetes. So
Right.
I don't know. I guess I just choose to try to reframe it a little bit.
Yeah.
Yeah, it obviously had its drawbacks. But I also feel like it has made me a more resilient person. I feel like I'm able to tolerate needles and pain and frustration and all of that
Yeah.
really well. And I will also say I'm very, very fortunate to have this sort of like textbook upbringing with
Mm.
two parents, still married, like fence with a golden retriever. Like I
Right.
am your pretty stereotypical suburban kid. And I know that is absolutely not the case for every household.
Right. Yeah. I was gonna say it sounds like you had a lot of like good support and that your parents like enabled you to live life to the fullest with diabetes. But yeah, it's definitely not the case for everybody. But it's definitely great that we have these new technologies that really enable um, children to have like a you know
Absolutely.
an easier time.
Yeah.
Okay, next one. I mean, we kind of touched on this before, but you can tell if someone has diabetes by looking at them.
um
Unless you're maybe looking for the pump or something. Or
Yeah, and this is interesting too, because growing up as a kid, again, I'm like just talking about my own experience here, but I didn't really, you couldn't know,
yeah.
unless you wear your devices proudly, like you just said, where with you put your CGM on your arm, or you've got a medical alert bracelet that can it's an open invitation for questions, awareness, not all the time, but I wear my CGM on my arm. I will go to a wedding with a CGM on my arm. Like I don't care. I'd rather people be curious and ask questions than hide it. That's
Yeah.
just me. But I didn't know anyone. I would not have known if anyone was living with diabetes as a child until pumps and CGMs came on the market. And
Right.
that was when I was about in high school, college. So
Mm,
I went like 10 years without knowing anybody.
right.
And at the same time, it was okay. Like maybe it would have been nice to have a play date every now and then, but I don't think my like childhood was robbed because until I was 10, I didn't have like close, amazing, awesome family and friends like living with it. It was more for my parents, to be
Right.
honest. And
Right.
they found their support in their own ways.
Um, on the note of people asking questions, do people ask you questions about your CGM or, other visible devices quite often?
No. And I wish they would.
Mm,
Um, because even like as a parent now, which is like a whole other podcast, a whole other like live. Um, I am caregiving now for two little kiddos and trying to manage a household and walk a dog and do all the things. And their needs often are prioritized over mine.
mhm,
So I wish more than anything that like I had my mom just be like, why don't I just come down and change your pump site for you? Or why don't I just do this for you? Because
mhm.
once you're on your own, you're really on your own.
Right.
And you don't have anybody else there to do that. But as a general rule of thumb, I wish more people would just ask questions about it.
Mm,
And like don't make statements, just ask.
yeah.
And as a social worker, it's just ask over assume, ask over assumption
Right.
all the time. I wish my closest friends, like here in my little community, or even those I've known for so long, would just ask, just be like, I can't, or acknowledge even,
Yeah.
wow, I like that must be so hard. Um,
Right.
they would know they'll never get it. They'll never get it unless they're living it.
Right.
Um, because most people with diabetes sort of make it look easy and they have it just go on autopilot, and now we use our phones as medical devices for many people who use insulin pumps and CGMs. So that in some ways is fantastic, and it's very isolating. It can be like
Mm.
very, very, very isolating. So just ask. So I'm glad you asked.
Yeah. Um, do you I've seen like memes about this and stuff, like how exciting it is to see someone out in the wild with a CGM or something. Do you ever approach someone and engage, or have you been approached by
Yeah.
someone else?
Yes, I've definitely been on the receiving end of it, like,
Mhm.
several times, like, "Oh, that's a CGM, like, my mom has one," or,
Mhm.
even, like, a few years ago, I was in Whole Foods, and a mom came up to me and was like, "Nice Dexcom, my kid has type 1," and now we're good friends,
Oh,
and
cool.
her daughter goes to school with my daughter, and they're buddies, and she's my neighbor, and I think it really just, like, depends on the context,
Yeah.
if I'm, like, really close to someone and I can tell they have a pump and I'm just like, "Oh, I like your CGM, I have one too."
Yeah.
But, I guess for me now in my adult world, like, I'm not looking to meet most of my professional world involves diabetes, so I have more than enough support in people that I know. For me, it's more about, like, how can I help you,
Right.
um, in that context, but yeah, several people have, like, approached me, and I think it's because I'm vulnerable and say, like, "Oh, look at me, look at my CGM on my arm," like, I'm open to talking.
Right.
And not everybody is there, and sometimes it takes longer for others to kind of, like, get there when it comes to welcoming the conversations, and once you do, I most people just feel better.
Right. Um, so we have time for a couple more. So another one is, if you have diabetes, you will develop complications.
I mean, knock on wood, I'm 35 years in and, like, I have all my organs intact and no real complications. If the standards of care that are put out by the ADA, are there for a reason. And the people that develop these standards of care, like the recommended, A1C or time in range for children and for adults. If you maintain an A1C under 7 or under 7.5 for kids with time in range and 70%, like your chance of developing complications like is almost erased. And so I think there's so much emphasis now on numbers and keeping such a tight graph. And yes, we want to do the best we can. But most of the time, if your blood sugars are in that threshold for a decent amount of time, you won't develop them, and you get care. And you get care and stay up to date with your prescriptions and take your insulin. Um, your chances of developing complications dramatically decrease.
Mm. Okay, and then we've got the last one. Diabetes is not a serious condition.
Um, I mean, it really depends on how you want to interpret that. I think it's pretty
Mhm.
serious in that, I mean, I said this earlier, it can go south very quickly. If you go 8 hours without access to insulin and you've had spaghetti and meatballs, there's nowhere for that food to go. There's
Mhm.
no insulin in your body meeting that food where it is in order to help break that down. Your body's going to start to break down the fat. You're going to start feeling symptomatic. You're going to start to develop ketones. You're going to probably vomit and not feel well and need to be hospitalized. So in that case, yeah, it is a very serious condition. We do our best as educators to make sure that everyone knows that. But from a day-to-day perspective, yes, it involves a lot of maintenance and a lot of thought and a lot of behaviors and potentially behavior changes. But from the outside looking in, most of us don't look sick. And
Yeah,
we do the best we can to self-manage. And when we are not feeling well, or we do have a low blood sugar or a high blood sugar, know that it's not our fault and we need to deal with it right away.
right.
So it's kind of like the 80-20 rule. Like, yeah,
Mm.
80% of the time, hopefully 95% of the time, I'm going to be great and my blood sugars are going to be fine. But when they're not, I need you to step in and step in now.
Right, right. Well, I mean, that is the end of my list of myths to debunk. But I know there are a lot more misconceptions
Yeah.
out there, and there are several forms of diabetes that are misunderstood. Um, but I think we addressed a lot of the most common ones today. And I want to thank you, Anna, for being adaptable
Absolutely.
and taking the
Anytime.
yeah, taking the responsibility on of addressing all of these yourself. I'll check in with Alicia after this just to make sure
No
that
problem.
everything's all right. But yeah, so I'll just state my little disclaimer again, and then we'll say our goodbyes. But nothing stated today is intended to be a substitute for professional medical advice, diagnosis, or treatment. Our discussion is for informational purposes only. Always seek advice from your healthcare provider for any specific medical conditions. So Anna, November is Diabetes Awareness Month. Do you have any like closing thoughts to share with our viewers about, the month or just, myths about diabetes or anything?
Yeah, I think my number one thing, and I said it earlier, just ask questions.
Mhm.
If you have questions, going back to the stigma discussion, just ask your questions. Don't or Google them.
Right.
Sometimes Google is off, but if you have questions, just ask. Because I think that is the number one way of just showing you care, and someone
Mhm.
is much more likely to share more if you ask them than if you just make a statement or assume.
Mhm. Yeah, that makes sense. Well, thank you so much again for joining us, Anna, and
Absolutely. Happy to help.
yeah, it's always great. It's a pleasure. And thank you to everyone who tuned in. The recording of this live stream will be available on our Facebook immediately after and also on our YouTube shortly. And we'll be hosting a couple other live events this month to commemorate Diabetes Awareness Month. So follow us on Instagram at Byram Diabetes Care to stay informed on all the great things we have planned. I hope everybody has a wonderful rest of your Thursday. And thank you.